up to $2 million in instant, affordable same-day coverage with no medical exam.
Call SelectQuote at 1-800-637-9116. That's 1-800-637-9116. Or go to SelectQuote.com. That's 1-800-637-9116. Full details on example policies at SelectQuote.com/commercials.
The arguments both for and against the two-party system are as old as the Constitution itself. And that's what will be at the root of this broadcast. How do we fix the antagonism which seems to be rooted in Democrats versus Republicans? Because the issues are always far more complex than that. And neither party has a solution or an antidote which will appease everyone, even from within their own party. Be sure to tune in this Sunday at 9 a.m. for AZ's On the Fence, right here on Money Radio.
Hey everybody, it's Mark Asher back to tell you about my great friends at the Lund Mortgage Team. Did you know that the Lund Mortgage Team was founded back in 1999? That's right, they're celebrating 25 years in existence this year. And you know what you have to do to stay in business that long? You have to be good at what you do. And the Lund Mortgage Team is not just good, they are great. They have helped thousands of people save thousands of dollars over those 25 years here in the Valley of the Sun. They only lend in Arizona, and they're mortgage brokers, which means they can shop your rate around. They're not tied to just one set of rates. Mortgage rates can get crazy. They can get high. They can get low. There's good times to strike, and there's times to stay on the sideline. Let the Lund Mortgage Team be your coach, be your team leader when it comes to these huge decisions. Call 623-875-9940. That's 623-875-9940, or you can always check them out at lundmortgage.com. Great website with all the tools you need. Call them today. They're my great friends, and you'll love them. It's the Lund Mortgage Team.
The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday. And indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. We're also podcasting now. You can catch us on any one of the podcasting apps. Just please listen, like us, recommend us, and please give us a review. So if this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening right here to the show, not to me, but to these extraordinary guests that I have come on the show. And the one I have right across from me today is an extraordinary guest. And it's incredible that it's been 4 years since I had you on. We were in the middle and in the throes of a pandemic when you were last here. And here we are coming at you live from the Scottsdale Air Park Money Radio Studios, June 21st, 2024. Stephanie Bivens, welcome back.
Thank you, Bob. I appreciate the opportunity to be here.
And for our listeners that don't know this, Stephanie is a lawyer. She's a speaker. She's an author and the founder of Bivens and Associates. She's also a wife, a mother, and now a grandmother.
Brand new grandmother.
Wow, you are one hot, sexy grandma.
Thank you. Yeah, my little granddaughter is just now 4 months old. It's very fun.
Yes, really, really cool. And I know that we're now doing some video here, but you did share some great pictures with me. And I understand the apple doesn't fall far from the tree.
My daughter looks just like me, and so far, grandbaby looks just like us.
Well, congratulations to both you and John and the entire family.
Thank you. Appreciate it.
So you're back, and here we are in 2024. And, you know, I want to just thank you. When we were going through some change at Cypress, I needed an office, and you were very thoughtful, and I'm very appreciative of the fact that you allowed me to share some space with you.
Oh, our pleasure.
And it was like for 2.5 years. It was like, wow, pandemic happened. Neither of us were really there.
Yeah, no, crazy time.
It was a crazy time. But you've moved on, and so have we. And I am really, really looking forward to talking to you to find out what you're doing now. So I'm going to just throw that big softball up and just say, hey, what's going on? Your practice is growing.
Yes.
You have molded and really guided so many attorneys that are here in the Valley that you helped get started, and they're now on to their successful careers. But you and I both know that there's just so much out there. We need a lot of professionals out there helping people with their planning and helping them really navigate the myriad of options that happen when life changes.
Absolutely. Yeah. So I've been a practicing attorney for over 25 years here in the Valley. I'm actually a Phoenix native, so one of the few. And we have a team of 5 attorneys, so 4 others and myself, and a really unique practice in that all we do is help our clients and their families with estate planning, probate, elder law, and special needs planning. And so most people are familiar with what estate planning attorneys do or probate attorneys, but there are still very few true elder law attorneys and even fewer special needs planning attorneys. So we get the unique privilege of helping older individuals or their family members with the aging process and guiding them through the legal issues that can often arise as persons age.
100%. And certainly it's one thing to have a plan, but you got to obviously keep up with the plan. I mean, a great example is you. Your children have gotten older, and now your daughter has extended her family. I mean, you may want to think about revising yours if you haven't already. And certainly, Sarah and Dalton.
Yeah, we've already talked about that with them. They're on it. So yeah, life changes. It's always interesting. We'll ask somebody, do you have an estate plan? And they'll say, yes. It's like, okay, well, the next question is, where was it done and how long ago? And then you usually find out, oh, it was back in, Illinois before we moved here full time, or yeah, we did it 15 years ago. I'm like, okay, time for an update.
Right.
Yeah.
I would love to ask this question. How frequently would you recommend people making these updates? I mean, obviously, when there are changes in the family dynamics, for sure, if there's a death in the family or if there's a separation or divorce and a new addition, but how regularly should we be?
Yeah. So rule of thumb recommendation is every 3 to 5 years. It's just a good natural time marker to sit down with your estate planning attorney and have a review of your documents as well as all of your accounts and assets and property, just to make sure that everything is still the way that you want. Obviously, as you said, there can be change in financial or family dynamics, but also financial, as well as tax laws and state laws can change. We're right on the precipice of a huge potential reduction in the federal estate tax limit if Congress doesn't do anything. And certainly they don't consult me, Bob, so I don't know what will happen.
Right.
But currently, our federal estate tax limit is $13.6 million per person, but it is scheduled to go back down to $5 million per person beginning 2026.
Wow.
It'll be indexed to inflation, so projections are somewhere between 6 and 7 million, but that is a huge change that obviously can significantly impact a family without proper planning. So we're seeing a lot of people now who are coming in and consulting with us on what does the landscape look like? What is, maybe what updates or modifications should I make to my estate plan now, just in case? So that's a prime example of why every 3 to 5 years, it's just good rule of thumb. Obviously, to your point, something happens sooner, call your lawyer, get in for a review.
Right.
Yeah.
I'm definitely dating myself, Stephanie, because I remember back when it was 600,000.
Oh, well, me too, Bob.
For the longest time, it was 600,000.
Yeah, absolutely. And then it bumped up to $1 million, and that was a big deal.
Right.
Yeah.
Right.
Yeah.
And Congress needs to approve this, or is it already earmarked for this to happen?
It is an automatic sunset.
Okay.
So if Congress makes no change, this is happening.
Wow.
Yeah. So there's a lot of eyes on this, a lot of pundits, talking about what will happen. We obviously don't know. We'll see what happens.
Well, and I do want to say this because the segments, as you know, go really fast. So you have this law practice and you have other attorneys that practice with you. How big is your firm? You specialize in these areas that you just described, whether it be special needs trusts, whether it be estate planning, elder law.
So we
share with us a little bit.
So we have 5 attorneys. I think the total team is about 13 people now. So it's not just me.
Yeah.
And I just work with an amazing crew. We all care about our clients. We all care about each other. Our rule is we sort of just treat everybody like family. I have a lot of family in my firm.
Yeah,
As you know, Bob, my husband, my sister-in-law, my brother-in-law, all work in the firm. My son is now on board and helping us as well. It's just turned out to be great, and just really, really blessed to help as many client families as we have over the years.
Right. Well, listen, the planning part is just so important. And I know that we talked about estate law or estate planning here in this first segment. I definitely want to dovetail and talk maybe a little bit about elder law and what's going on there in the second segment, because, we are aging at such a rapid rate. It's crazy. I mean, the 65-year-old population between now and the next 25 years, you've been practicing for 25. So in the next 25 years, it's going to double.
Yeah.
And the 85-year-old population is going to quadruple. So, I mean, we have to really do what we can to protect one of our most vulnerable. Obviously, you know that children are, because you do a lot of special needs trusts, but certainly our older adults are right there behind them in terms of the needs and really protecting them.
Absolutely. And they need to get their estate planning in order. So if they become incapacitated and their adult family needs to help over and help step in and advocate and pay their bills, they've got the right legal tools to be able to do it without having to go to court. It's just vital.
Well, we can talk a little bit about that in the second segment. You hear the music. We got one segment down. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Stephanie Bivens here in the studio with me. Stick around. 1 down, 3 more to go. We'll be right back. Hi, I'm Bob Roth, and I'm the host of Health Futures, Taking Stock in You. We've been on the air here on Money Radio since January 2014. I'm also the managing partner for Cypress Home Care Solutions, and we understand the importance of compassionate and trustworthy home care. In fact, we created Cypress Home Care based on our own personal experience of being caregivers for our own mom. We're locally owned and operated, and we are an in-home care supportive service agency founded in 1994 to better meet the needs of our community. You see, Cypress is a solutions-driven business dedicated to providing different levels of knowledgeable and experienced care to people who wish to stay in their own home. We assist with the needs of our clients with activities of daily living, from cooking and shopping to driving to appointments and even doing laundry. We also offer respite services by providing the relief family members so desperately need. So call us today at 602-264-8009 or look us up on the web at cypresshomecare.com.
At Desert Wholesale Diamond, we pride ourselves on providing top-tier quality, unmatchable prices, and excellent service. I'm Diamond Dave, and my track record in the diamond industry dates back 4 generations. I've eliminated the traditional middlemen, providing you with direct access to wholesale markets.
I'm Jada Cantor, and we offer you the best diamond buying journey of your life. With 3 wholesale offices and a dedicated production team, we make it easy for you to buy diamonds at unbeatable wholesale prices.
Our 34 years of industry leadership proves our dedication, and we continue to lead the way in all areas, particularly in lab-grown diamonds.
Save yourself from paying retail. Experience the most pleasant diamond buying experience ever. Meet Diamond Dave and his team, who are all waiting to assist you with your wholesale diamond purchase.
Call Diamond Dave at 480-397-2450, 480-397-2450, or follow him on Instagram at Diamond Dave Cantor. That's at Diamond Dave, Kantor.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth. And if you're just tuning in, I got Stephanie Bivens here in the studio. She is the managing partner and the creator of this great firm called Bivens and Associates. They're a law firm specializing in estate planning, probate and trust administration, elder law, and special needs planning. If you missed our first segment, you can catch it right up on our website at cypresshomecare.com. Click on the media button right below its radio show. You'll catch this one and many, many more. You know, we talked about in the first segment, we talked about estate planning, and I know I jumped saying we'll talk about elder law, but there's so much more we need to talk about estate planning. And, you know, I'm just looking through my notes here, and I really want us to go through some of the aspects that you want to share with our listeners, because it's more than just having a will, right?
Oh, it's so much more than having a will. And that's what everybody kind of thinks, right? And I will say, from a traditional estate planning perspective, most estate planning lawyers, in my experience, focus on the aspect of when a client dies, how do we get their assets from point A to point B, sort of the mechanics of it. I think as an elder law attorney, I can do that piece very simply and easily. But what we're really looking at is the quality of life for the client the decades before they die, right? If they become incapacitated, who's going to be their decision maker? Where do they want to live? How are they going to afford their long-term care? What does that look like for them? And what are their preferences? Similarly, with regard to financial management, who is that going to be? Is it going to be a relative, a friend, a professional entity like a bank and trust company? And really thinking through the mechanics of, practically speaking, once their legal documents are in place, if they get enacted due to incapacity, which I always tell clients means if you're still with us, but you're not with it, Bob, that's legally what incapacity means, right? If you're still with us and you're not with it, who's going to take care of all of this stuff for you? And nobody gets to do this, particularly handle your financial matters, unless you've put the right legal documents in place. And so that's a durable financial power of attorney or a trust. And if you have a trust, you'll end up having both. So they're really important documents. Medical directives, they're often overlooked. People really don't understand the importance of them. And since we're on Health Futures, I'm going to focus on that for a moment.
Sure.
In Arizona, we offer a healthcare power of attorney, a mental health power of attorney, a living will, and then we always recommend a HIPAA or a medical release as well. The importance of these documents are if you become incapacitated and all of a sudden you are no longer able to make and communicate your own medical treatment wishes, who gets to do that for you? Who knows your wishes, right? Super important. And if you don't have this written down in legal documents, these powers of attorney and a living will, our legislature, Bob, has decided who gets to make your medical decisions for you. May or may not be the people you want, may not work out well, but that's who you got. So it's your spouse. If you're not married, majority vote among your adult children. And I know some of our listeners just went, oh no, right?
Right.
Group vote among all of our children. Are they going to agree? Do we like them all? Do they all like us? Right? That can cause a lot of drama, particularly in a hospital situation. So it's better that people have these documents in place. They have a clear chain of command. So if something happens, car accident, serious illness, and for some protracted period of time, again, you're with us, but you're not with it.
Or a fall, by the way.
Exactly, a fall. I see it all the time. There's no issues. Without these documents, there's a really good chance this family is going to end up in the probate division of the court during lifetime, seeking guardianship and conservatorship. And we do a lot of that. Letty in my office, it's all she does. It's court work. She's phenomenal.
Oh, yeah.
But let me tell you, we as lawyers are the only ones having a good time. My client families are not loving the experience of paying lawyers lots of money, spending lots of time, getting strangers involved in what really should be a private family matter.
And the emotional stress.
Absolutely.
So
it's
stressful.
so, I've always said to people, putting your estate planning in order, it's a two-part gift. The first part is for yourself. Right? You get to pick the people you know, like, and trust and give them instructions on what you want to have happen, right? So you're in a position of control, even if really you're not able to be in a position of control. Who doesn't like that? Right. And it's a gift to your family because there's a clear chain of command. Everybody knows what you want, who should be in charge, and how to perform for you when that time comes. Without these documents in place and without current documents in place, like we talked about in the first segment, Sometimes we end up in court. Sometimes we end up in big family fights, or we just end up spending a lot more money and a lot more time and a lot more stress figuring it all out.
Right, right.
Yeah.
Well, you mentioned a number of different things, and I want to tackle, one, the mental health care power of attorney. Arizona is one of the few states that have it. And certainly one of the things that we have here in the state of Arizona, we have a higher incidence of dementia and Alzheimer's here.
Yes.
It is the fourth leading cause of death in this state, fifth largest leading cause of death in the country. But we have more people with it here, and that healthcare power of attorney. Can you talk a little bit about that?
Absolutely. And I have all of my estate planning clients, even my clients who've never been diagnosed with even a garden variety mental health disorder, right? Just an anxiety or episodic depressive, right?
Right.
Episode. I have all of my clients encourage them to have a mental health power of attorney. With a mental health power of attorney, if you need inpatient psychiatric hospital level treatment, this power of attorney allows the agent, the person you designate to be your medical decision maker, to admit you, consent to the treatment, and get you discharged without having to go to court and getting an emergency mental health guardianship over you. And I always explain to everybody, if you need this level of psychiatric hospital treatment, you're going to get it. Are we just going to get you there the easy way with a mental health power of attorney? Or are we going to do it the hard way with either a Title 36 civil commitment proceeding, which means the state is now going to be in charge of your mental health treatment for an entire year, or a Title 14 mental health guardianship, which is what we do for clients when we have to. You're going to get the treatment you need. It's just, are we going to do it the easy or the hard way? So mental health power of attorney is really valuable. I always tell clients, it's sort of like that weird wrench you have in the toolkit. You probably don't need it, right, on a regular basis. But if circumstances are you need that weird wrench, we're going to save you a lot of time and money because you don't have to drive to the extra hardware store and make it happen.
I love the metaphor. That's so perfect.
Yeah.
So I want you to talk a little bit about living will, because, we throw that word around, but living will, it's synonymous with the DNR. Is it not synonymous? Explain to what a living will is.
Yeah. So, and I'm glad you brought up DNR because I didn't mention it earlier. So a living will is not a last will and testament, nor is it a living trust. And everybody gets it confused.
Of course they do.
I don't know why lawyers didn't name it something better, but it is called a living will. And what a living will does is it allows you to put in writing your end of life medical treatment wishes. So most people use a living will to say, I want reasonable medical treatment rendered if I'm critically ill. But if after that reasonable medical treatment has been rendered and there's no hope of restoring me back to an acceptable quality of life, if I'm in a permanent vegetative state, I'm terminally ill, end stage, no consciousness, they don't expect me, I will regain consciousness, or a significant brain injury with the same effects. Most people would say, you know what, at a certain point, quality of life is going to be more important to me than quantity of life. And I would want my agent to have the discussion with my medical team, with the living will as the baseline for what would I as the patient want, so everybody can come to the right decision, because I'm not at that point going to be able to weigh in. So you're weighing in with your living will. It's very different from a DNR. Everyone should have a living will. A DNR is a do not resuscitate, or we commonly call it an orange form because it's supposed to be on bright orange paper. And it serves one purpose, simply to say, if you have a cardiac event, you do not want CPR administered. So most people don't want a DNR, Bob, unless they are already on hospice, right? And they think, if I had a cardiac event and it's my time, I don't want to be resuscitated to then succumb eventually through my end stage of my terminal illness.
Right.
I've had very elderly clients, my little 104-year-old lady, she's about 80 pounds, dripping wet, the size of my pinky. And she's like, holy moly, I have had a fabulous life. If I have a cardiac event and it's my time, I don't want every bone in my sternum broken with CPR, because that's what will happen to only then maybe not.
104-year-old, absolutely.
Right. So DNRs are not for everybody. But statistically in our country, we see most people on hospice with a DNR. Mostly the agent under the healthcare power of attorney, when the patient is in the hospital, will end up putting the DNR in place for the patient at that point.
Nice.
Yeah. So really different documents. Everyone should have a living will, DNR, situationally.
So all of these, healthcare power of attorney, mental health care power of attorney, living will.
Yep.
DNR.
Yep.
HIPAA.
HIPAA. I'm a big advocate of the HIPAA. And most people know your doctor's not allowed to tell anybody, even your spouse, your kids, right? Your best friend, anything about your private medical information, your diagnosis, treatment, etc., unless you authorize in writing the release of that private medical information. And this is a federal law. So if you have a primary care doctor, I guarantee you they ask you to fill out a little form at that office, but that doesn't only works at that office. So we do one that works everywhere. Surgery centers, hospitals, pharmacies, everywhere. It helps the family work as a committee.
Now, you talked about it being a gift, and it is an incredible gift, especially the living will piece.
Yes.
We're out of time. It's halftime here. We're not out of time. It's only halftime. So stick around. Stephanie Bivens is here in the studio. We'll be right back.
Know the score before you vote in 2024. JD Hayworth here. Join me weekday afternoons 3 to 5, live and local on Money Radio.
I'm Jerry Willis, and this is the Fox Business Report. Stocks are mostly lower as markets pull back a bit after the recent AI-fueled rally lifted the S&P 500 and NASDAQ to new highs earlier in the week. Tech stocks are falling, with chip makers leading the charge. NVIDIA stock is falling over 2%, adding to losses from the previous day. However, NVIDIA shares have risen 164% this year, and American Express has gone shopping and is buying Squarespace-owned restaurant booking platform Tock for $400 million. Amex is looking to expand its footing in the dining industry, a category that accounted for around $100 billion in spending on its cards last year. And shares of Gilead Sciences continue to spike and are up around 2% after rising 8% yesterday. On news that the biopharma company said a late-stage trial of its HIV prevention treatment was found to be 100% effective. It's your Fox Business Report. I'm Hillary Barsky, invested in you.
Donald Trump Jr. here. Since January of 2021, the cost of living has increased by 17.9%. You can't get that money back, but you can stop your losses by diversifying into a gold IRA from my friends at Birch Gold Group. To learn more, get your free info kit on gold IRAs by texting the word SHELTER to 989898. That's SHELTER to the number 989898 to get your free info kit from Birch Gold now.
Message and data rates may apply.
Do you have multiple years of unfiled taxes or owe more than $8,000? The tax attorneys at Allies Tax Relief are your ally and will stop the IRS from garnishing your wages or them levying your bank account. Call 800-230-5174.
Money Radio listeners tune in to learn about wealth, but how about your health? Well, now you can have both. This is Dr. Stephen Katz, co-host of Your Health is Wealth. Each week, we'll explore a variety of common health issues, including joint pain, chronic conditions, and issues specific to men's and women's health, and reveal the latest innovations to get you feeling good again naturally. So join me, Dr. Stephen Katz, and my team from the Naturopathic Physicians Group each week for Your Health is Wealth. Fridays at 1 p.m. right here on Money Radio, 1510 a.m. and 105.3 FM.
How would you like to make money from a bank instead of the bank making money from you? How can you do this? This is Ference, host of the Your Personal Bank Show. We have banks that fund ongoing annual premiums into your high cash value policy that is principal guaranteed. Why would they do this? Cash is an asset and can be used as collateral. When you earn more in dividends from your policy than the interest the bank charges, you keep the difference. The difference has averaged 2 to 5% annually in your favor for the past 40 plus years. When the funds are contributed from a bank, you leverage other people's money and multiply your returns. Your average rate of return can grow to strong double digits annually within a few years. This can be done income tax-free with guarantees and no downside market risk. Contact me at yourpersonalbank.com or 866-268-4422, 866-268-4422 for more information, or tune in to the Your Personal Bank Show Tuesdays at noon.
Join the free smoothie party at Tropical Smoothie Cafe on June 21st for National Smoothie Day. We're treating our Tropic Rewards members to a free smoothie with bowl or food purchase. Order in-app, online, or pop by the cafe for a little sip and chill. 3 cheers to our Tropic fam. Terms and conditions apply.
I'm Chad Robison with Your Money Now. Stocks remain narrowly mixed here in the final hour of trading today. The Dow Jones Industrial, the only major index gaining, up 29 points. Newly named Washington Post editor Robert Winnett has decided not to take the job instead remain in England amid leadership turmoil at that news organization. Several published reports had raised questions about Winnett's involvement in articles where a source was paid and information gathered through deceptive means, practices more commonplace in England but frowned upon by journalists here in the United States. Netflix is making another big announcement, this time for 2 new brick-and-mortar stores slated to open in 2025. The immersive experiences are set to debut in King of Prussia, Pennsylvania, and Dallas, Texas. Right now, U.S. oil prices are off their July closing price at $82 a barrel and are at $80.59. Yeah, it's your money now.
Whether you own a local business or a global one, you're always looking for ways to position your operation to create opportunities and move on them faster. With Bank of America, you get access to experts, award-winning insights, and business solutions so powerful you'll make every move matter, locally and globally. Visit bankofamerica.com/banking for business to learn more. What would you like the power to do? Copyright 2024 Bank of America N.A.
I'm Kareem Abdul-Jabbar. I learned about atrial fibrillation the hard way. My symptoms would come and go, shortness of breath, fatigue. I kept going. Then I got so lightheaded, I couldn't. My doctor said I have AFib, so I'm about 5 times more likely to have a stroke. Other symptoms, irregular heartbeat, heart racing, chest pain can come and go, but the risk of stroke stays. If you have symptoms, tell a doctor. Visit notimetowait.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. We got a little who bringing us in the second half. Love that. I got Stephanie Bivens here in the studio with me. She's with Bivens and Associates, and they do estate planning, probate and trust administration, elder law, and special needs planning. And if you missed our first half, go up to our website at cypresshomecare.com, click on the media button. Right below that's radio show. You'll catch this one and so many more. Stephanie, it's just so great to have you here in the studio. I can't believe it's been 4 years. Don't ever let that much time go by. It really is.
I'll be here anytime it works for you, Bob.
Because this stuff that we're talking about is so important, and it all falls under the heading planning.
Yes.
And, if you don't have a plan, then you plan to fail. And certainly we want to make sure you have a plan. So in the first half, we really spent a lot of time talking about estate planning. And I really appreciate you walking us and me through the very important elements that we need to really have in place. And certainly the underlying piece or the underlying message is it's a gift. You are giving your family a gift by telling them what your wishes are.
Yes.
Which is so important. So now I'd like to go over and talk about elder law and talk about navigating, aging and how an elder law attorney can help you and your family. So if you would be so kind to really walk us through that, because when I first came to know you, that was really special needs trust and elder law was really the crux of who you were.
Yeah. And I've been practicing elder law for over 25 years. I'm a certified elder law attorney by the National Elder Law Foundation. There's still fewer than 600 SELAs across the country. So,
and not many here in this state. Right?
No, very few of us.
I remember when you got that
States.
certification.
Yeah, I think I've had it about 15 years.
Wow.
You pass a big exam. It's like the bar exam on steroids, Bob. But so I've maintained that designation. I've worked with hundreds, probably thousands of families. And really being an elder law attorney is more defined by who we serve than exactly the area of law. And when I say that, that means our clients are either the senior themselves or oftentimes their adult loved ones, whether it's the adult child, grandchild, niece, nephew, whoever it is in their life. And sometimes it's a friend that is there trying to support them through the aging process. And so some common issues that we see in elder law are incapacity. What happens when somebody is experiencing health issues and maybe they're in cognitive decline or physical decline and they start needing help, either a little bit or a complete takeover of managing their finances, their personal decisions, medical decision making. And how we help with that is we can make sure that all of the right legal documents are in place so that the right person is going to be able to actually legally do those things. Because shockingly, families come to learn you don't just get to make medical decisions all the time just because you're related. Certainly you cannot handle somebody's financial matters unless you have a legal document giving you that authority, even for your spouse. So a lot of people don't realize. And then, also the concerns with aging, sometimes brings up long-term care, and you're in that world, Bob. There's so many people who are at home and need help with their activities of daily living, or perhaps activities of daily living need more support than what can be provided at home. And we need to start looking at adult care home placement, memory care, all the way up to skilled nursing or general assisted living. And that's expensive. It is not cheap. And so a lot of concern comes around, how are we going to afford it? So we work with families to figure out how are they going to afford it. And we're not financial advisors, we're lawyers, but we can work in concert with the financial advisors, the tax professionals, and kind of run the landscape. We know what the costs are. We can help do some projections with this family and come up with a long range game plan. And oftentimes it may be that we are projected this individual is going to outlive their resources, and maybe they're married and the spouse is worried about how are they going to buy groceries or put gas in the car if they go bankrupt due to the spouse's long-term care costs, which Medicare doesn't have a long-term care benefit. So Medicaid does. In Arizona, our state Medicaid program is called the Arizona Long-Term Care System, or ALTEX, ALTCS for short. And the ALTEX program can help provide home care or assisted living all the way up to memory care, skilled nursing, but you have to meet medical and financial criteria. So we help a lot of families identify if Altex is going to be the solution to avoid the bankruptcy, and how we can help them position their assets, preserve their estate, save the house, save as much as possible of their life savings for the spouse or future generations, while at the same time ensuring they get the quality of care they need and, more importantly, deserve. So that's a big part of what we do, is just helping the families understand the system and navigating through it. I'm a big believer that with better information, you can have better outcomes. And I can't tell you how many times I've sat down with a family and they're like, we've been struggling with this for 5+ years. We didn't know where to turn. We wish we would have talked to an elder law attorney sooner. I just think there's just not a lot of us elder law attorneys out there, and the senior population really doesn't know about us enough. But we can really help a family navigate. And we often collaborate with other senior care partners. So I've referred to your company on multiple occasions. I just gave Cypress Home Care a referral the other day, talking to a family. But we work with financial advisors, tax professionals, placement professionals, neurologists. We can spot the issues because we've walked this walk with other families
25 years.
For 25 years, and we can bring in the holistic solution. So I always say it's practicing law with a whole lot of social work sprinkled in.
I'm so glad we're talking about this, because long-term care is something that people don't really understand.
Yeah.
People are under this false impression that Medicare is going to pay for it.
Yeah.
Newsflash.
It doesn't.
It doesn't.
No.
And your Medicare Advantage doesn't. Even though they
Right.
say they're making these provisions, there really isn't a carrier out there or a provider out there that's going to provide you services. At least for any time beyond maybe the 40, 60, or 100 hours per member per year that is authorized.
Correct.
So, you've got Medicare supplement, not paying for it. So there are 4 payer sources that people can utilize to be able to have long-term care. One's private funds, which I typically call family funds, because nowadays families are helping out. The other one's VA benefits. The other one is long-term care insurance. If you were smart enough and you were able to purchase one of those back 20 years ago when they were plentiful, and now they're very few and far between.
Right.
And then the last one is Medicaid in our state. And you said it so well. I mean, you have to qualify both medically and financially.
Yeah. And the only subjective part of the application process is the medical eligibility. So we spend a great deal of time coaching our clients on which medical providers to see how to get the correct medical documentation to confirm that the individual does need a substantial amount of help with their activities of daily living, and that is the cause for the need for that help is a medical condition. You would think it would be obvious, but if you don't have the right documentation, you can't prove your case. Right. And so you'll get denied. So we spend a lot of time coaching clients through the medical eligibility criteria, as well, obviously, through the financial piece. And Altex isn't for everybody. I have a lot of clients that come into me and they said, oh, we heard something about Altex, and we run the numbers and we look at the scenario based on the delivery of care and all the dynamics. And we're saying, you're good to go. You're a private pay. But what we do need to do is get all of the estate planning documents in place. So you're not going to hit a roadblock at some point in the future dealing with a financial institution, or if the family home needs to be sold, you're going to have legal authority to do that. So the estate planning and the elder law overlap. We're almost always doing estate planning inside of an elder law matter for clients. Financial exploitation is another, unfortunately, sad and prevalent issue we see, whether it's a neighbor or a relative who starts taking financial advantage of a vulnerable adult. Oftentimes we end up in court with guardianship and conservatorship proceedings to prevent future exploitation and to get protective court orders in place. So we do a lot of that work involving exploitation. So there's just a lot of common themes we see with people in aging. But to your point, Bob, with planning ahead, you can have much better outcomes by simply doing some planning. I hate it when we get a call, and we get calls like this several times a year. Daughter calls the office and says, I need a power of attorney for my dad. He's in a coma in ICU. Well, it's too late because dad's the only one who can sign the power of attorney. He's no longer competent. Right. So what's our option? We have to go to court and get a conservatorship over dad. Well, a simple power of attorney that would have cost pennies on the dollar
100%
compared to a legal proceeding that's going to be in place for the rest of this individual's life. You know, people know they want to avoid probate. They think probate happens only after somebody dies, but guardianship conservatorship happens in probate during lifetime.
You know, you said so much, and there's so much to kind of unpack. And I know we're getting ready to break here on our third segment, but I do want to say one thing. We talked about how often you need to review your estate plan. The cost of long-term care services in the last 5 years, since 2019 to today, is up 40 to 50%. That's for in-home supportive care services from our home care agency like ours or an assisted living. So it's really important for you to sit down with your professionals and have these types of conversations.
Absolutely.
I want to come back and talk a little bit about this in the fourth segment. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth. Stephanie Bivens is in the house. Stick around. We'll be right back.
My brother-in-law died suddenly, and now my sister and her kids have to sell their home. That's why I told my husband we could not put off getting life insurance any longer. An agent offered us a 10-year, $500,000 policy for nearly $40 a month. Then we called SelectQuote. SelectQuote found us identical coverage for only $18 a month, a savings of nearly $300 a year.
Whether you need a $100,000 policy or a $10 million policy, SelectQuote could save you more than 50% on term life insurance. In a hurry? Don't worry. With SelectQuote, you can get up to $2 million in instant, affordable same-day coverage with no medical exam.
Call SelectQuote at 1-800-637-9116. That's 1-800-637-9116. Or go to SelectQuote.com. That's 1-800-637-9116. Full details on example policies at SelectQuote.com/commercials.
The arguments both for and against the two-party system are as old as the Constitution itself. And that's what will be at the root of this broadcast. How do we fix the antagonism which seems to be rooted in Democrats versus Republicans? Because the issues are always far more complex than that, and neither party has a solution or an antidote which will appease everyone, even from within their own party. Be sure to tune in this Sunday at 9 a.m. for AZ's On the Fence, right here on Money Radio.
Tired of that same old spin on Washington? You want the truth? Then listen to All Right Now with me, J.D. Hayworth, every weekday, 3 to 5 p.m. right here on Money Radio. I'll give it to you straight. I've represented you in Washington, and I've lived to tell some tales. You can get involved. Call in, text our show, and you know you'll get it right. It's all right now, every weekday 3 to 5 right here on Money Radio.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And if you're just tuning in, we're in our fourth segment. I got Stephanie Bivens here in the studio with me. She is with the Bivens and Associates law firm. They specialize in estate planning, probate and trust administration, elder law, and special needs planning. And if you want to learn more about them, how do we find you? We find you on the internet, right?
Absolutely. So Bivens Law, BIVENSLAW.com.
Perfect. And you can call them too at 480-922-1010. So we were talking about elder law in the last segment, third segment, and certainly talking about financial exploitation. And the other piece that, you probably see a lot of, and you see all kinds of family dynamics.
Yeah.
But undue influence
Yes.
is a big deal for the elderly because they feel extremely vulnerable. And whether it be a family member or friend, sometimes they are putting a lot of pressure on them. And it leads to financial exploitation and other exploitations.
Absolutely. Absolutely.
So I think, one of the things that, I would love for you to just share with us as family members, we need to be really cognizant of what's going on with our loved ones and their lives. And unfortunately, we live in a world right now where my trade association discerned from this resource that they used that was in this publication that we put out in 2016 that really talked about the home care industry. And that is that the average distance between an adult child and their parent is about 280 miles. So they don't necessarily live here, so they don't know what's going on.
Yeah. And it's really hard to get a clear picture of what's happening when, you're the adult child and you live out of state. And when you call mom and dad, they sound fine on the phone, right? They're masking what's going on. And what you may not know is there's rotting food in the refrigerator. Their medications are not being properly managed because they're just not able to have the same level of organizational skills as they start to have diminished capacity. And they may start relying on the neighbor they think is altruistic when the neighbor is now in their house and helping them out and says, "Oh, you have vision problems. I'll just help fill out the checks and you can sign them to pay your bills." Well, you can see easily we may have the world's best neighbor or we may have the world's worst neighbor. And when the adult child is not there, they're not able to see what's going on. They don't have access to the online access to the accounts to have some checks and balances. It can be a very shocking experience to find out there's money missing from an account. Oftentimes with exploitation and undue influence, the senior may not even know it's happening, right? They have vision impairment, cognitive impairment. They may have no idea what's happening. And with financial exploitation, they do estimate it is the largest underreported crime against seniors because oftentimes when the senior finds out, when it is a trusted person, the neighbor they thought was great, the adult child, right? They have a lot of guilt about turning them in. They have a lot of shame about getting swindled. They have pride. They don't want to get this person in trouble. There's all kinds of reasons. And in fact, this individual may be isolating them and saying, well, if I'm not here to help you, nobody will. You're going to have to go to the nursing home, and turn it into a very threat type situation. And I've seen it all over my career. I think the best thing families can do is really to take an active role, talk often, visit as much as possible. Care managers can be a wonderful advocate if you're out of state and you don't have boots on the ground, eyes and ears that can check on your parents. Care managers can fill that role. They can be hired. They can do welfare checks. They can go to the doctor with your mom and dad. So when mom and dad are not understanding or remembering 100% of what's being told or advised to them by their medical professional, the care manager is there and can explain it to the parents and report accurately back to the adult children. So there's lots of solutions. Involvement is the best solution, to your point, Bob. And a lot of that is going to start with the conversation with mom and dad.
100%.
How can I help you? What kind of support? If something goes wrong, and you never want to talk to mom and dad about, oh, if you get Alzheimer's and you can no longer, think clearly. Nobody wants to think about that. Right. But everybody knows somebody that had a stroke. Everybody knows somebody that got into a car accident. So you want to give the example of what if something sudden happened that it can resonate with them, So you don't have to tell mom and dad, oh, I think you're having cognitive decline, right?
That's not going over well.
Pushback on that conversation. So there's smart ways. You can also get into caregiver support groups. I think they're really advantageous for 100%. The adult children to learn how to have those conversations and also to learn what resources. As an elder law attorney, I can talk with the adult children about their concerns for mom and dad and give resources and referrals. Caregiver supports can do the same thing. There's a whole industry of professionals, but you want to work with experienced, credentialed professionals that have been vetted. So you're getting the best advice and the best support.
You've painted a great picture. And, I do want to add one other thing. And you said it earlier, is that, and I experienced this with my own father, is to make sure that you are on the accounts.
Yeah.
Because, and I'm talking about the financial accounts.
Mm-hmm.
And you, if you're designated as the power of attorney, you should be on there, but you should also be monitoring them and see what's going on so that you can avoid an exploitation.
Right.
A situation like that or undue influence.
Yeah.
So we have about a minute and a half, and I know I wanted to talk so much more about things.
Mm-hmm.
So as we close here, I want to leave the mic open to you. Is there a question I haven't asked? Is there a lasting thought you want to leave with our listeners and me?
Sure. So I appreciate that, Bob. Well, I do have a special offer for your listeners. And this is a resource that I think everybody can use, which is why I created it after decades of working with families. And we're talking about the gift to the family, the gift of information. You don't have to be our estate planning client or our firm's client to use this. I created what we call our private information guide, a personal and financial organizer. It is available on our website. So it's bivenslaw.com/e-books. And I created a 20% discount. It's only $14.95, but I've got a 20% discount with the code HEALTHFUTURES, all together, no space. So Health Futures, 20% discount for the next month for your listeners. The idea is it's an easy to use organizer, but it's beyond anything you've ever seen. It's got all your personal information, financial information, professionals, medical, financial. So if you dropped on the floor unconscious and somebody needed to pick up your life, right? Your dog gets sick. Who's the veterinarian for Fluffy, right? Your pool goes green. Who's the pool guy? Where do you bank? Who's your lawyer? Where do you store your documents? What's your health insurance company insurance information? It's all in there. It's so vital.
So once we fill this out and we go to Bivens Law to get the form, who do we give this to?
You want to keep it private. Please don't print it out and leave it on your coffee table, right?
Okay.
You want to put it with your estate planning documents. If you are already sharing this information with your family, perhaps that one person in the family. Otherwise, put it with your estate planning documents, keep it private, but it will be available and current if something happens to you.
Stephanie Bivens, so great to see you.
Great to see you, Bob.
I can't wait to see this little Savannah in person. It's so excited for both you and John. And certainly Sarah and Dalton. I'm sure they're just amazing parents and loving this child like no other.
Absolutely.
Make it a great day. Have a great weekend. We'll be back next Friday. Thank you, Stephanie, for being here.
My pleasure.
Place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009.